My name is Kishore Chandiramani and I am a psychiatrist based in England. Today we are going to talk about a 6-session stress management program that we have developed at the Emotions Clinic in England. This program is an integration of 6 different therapy approaches rolled into one, such as cognitive behavioral therapy, mindfulness meditation, psychodynamic therapy, interpersonal therapy, biofeedback treatment, and other forms of relaxation techniques such as breath regulations. Now let me explain how this program differs from conventional psychotherapy. About 100 years ago, Sigmund Freud, who is considered father of psychoanalysis, said, "I can help my clients convert their clinical suffering such as anxiety or depression into normal human suffering. But I have no solution to the problem of normal human suffering." Now this program has elements of spirituality such as mindfulness meditation, and this approach addresses the issue of normal human suffering. So therefore this program will be applicable to each and every individual and not just people who suffer from anxiety and depression. The other difference is that this program helps you address your emotions the way a therapist does with their clients. So it stops you from becoming reliant on a therapist, and we don't believe that you need long-term therapy with a therapist to deal with your problems. In 6 sessions, you learn quite a bit about the way in which you should address your emotions. Although the journey is very long, but you know how to do it, so there's no need to be in long-term therapy if you are following this approach. And thirdly, the focus is more on the processes of the mind rather than the contents of the mind, or trying to understand the meaning of the mind. We try to change the emotions rather than try to go into the details of each and every emotion. And sometimes I have found that clients come and tell me that after discussing their issues with therapists, they end up feeling worse. And let me explain how this happens. In combat situations, when soldiers go on the front line and they come back to the base station, they sit around a campfire or maybe coffee table and narrate their experiences. This is known as debriefing. And we have found that some soldiers find it very helpful to discuss their issues, whereas other soldiers end up feeling worse. For them it's like double whammy. They have been in the traumatic situation and they come home and you want them to go back to those memories and talk about those issues. So they said they would rather, go to the bedroom, lie down, and they want to rely on their sleep to undo the emotions. Do you know what the difference is? People who end up feeling worse are the ones who have not yet learned how to process their emotions, and that's why they rely on sleep and other forms of relaxation. Whereas those who feel better after a debriefing session are the ones who have learned the technique, or they know the coping strategies in dealing with their emotions. Now this program prepares you to do exactly that. Learn how to address your emotions at a psychological level so that you don't have to rely on other methods or medication. Thank you very much.